Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Vare Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Tuesday, today Wednesday, on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, the 2nd of August. We invite you to submit your questions via Facebook at NU Institute for Global Health or by email globalhealthinstitute@northwestern.edu. And leading the discussion today is myself, Sophie Bukowski, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Thank you, Sophie.
Yesterday in the United States, we saw 176,726 new cases. We are seeing a 4% decrease over the last 7 days, but cases for a 7-day average are still hitting over 120,000 positive cases per day. Hospitalizations have also increased by 5%, and the death rate has also increased by 4%. In Illinois, fortunately, we are seeing a slight decrease in cases over the last 7 days, but yesterday in Illinois, we saw over 10,000 positive new cases, with the death rate decreasing by 21% and hospitalizations increasing by 5%. Okay, what can you tell us about what these numbers actually mean with the state that we are in the pandemic today?
Yeah. Well, remember now that these reported cases are all confirmed cases that a laboratory has done. It doesn't include any of the people that got tested at home by themselves or someplace with the rapid test that's not reporting things to the laboratory. So you really multiply that by a factor of about 7. So there's really 1 million cases per day right now. That's why it seems like everybody has COVID. I mean, like, it's just so rampant right now. So we're at the peak of this wave, whatever wave this is. I think it's wave 6, it depends how you count. But we're not like increasing dramatically. We're not on the upswing, but we're at this peak. And it hasn't started going down yet. Now, South Africa, which got the BA4 and 5 variants first, and were also the first to report it, have had a really precipitous fall in cases. I mean, they just plummeted very quickly. So I think what will happen now, South Africa, we have many more people in this country, and it's much more diverse and larger. So we're not going to follow them exactly, but I think we should start seeing this drop in the near future. So when's the near future? It could be a month. We'll see. But we'll just have to keep our eye on these cases.
Yeah, absolutely. And, speaking of the increasing cases, our first big headline is that COVID is still surging across the world right now, especially with BA5 taking over in so many places. What can you tell us about how this compares, the United States compares to like the rest of the world right now?
Well, the US accounts for 80% of all the BA5 cases that are being reported. So like we're way over represented with BA5. And most likely this is due, if you look at our peer countries. So peer countries are high income countries, well-developed with a lot of resources. If you look at them, we have one of the lowest vaccination rates of all those countries. It's around 60% of people have had the 2 doses, and only 30% or so have had 1 booster. And at this particular point in the pandemic, you're supposed to have 2 boosters if you're eligible for a booster at all. So it's where we are today. We're not in a very good place, and the only way we can deal with this, because it looks like it's not going away, is to keep our immunity up to date. And if you're eligible, you're over 50 or you're over 12 with some underlying disease, you should take Paxlovid, the treatment, and there'll be more treatments in the future too, if you do get sick. So that will keep the hospitals, operating efficiently and not being overwhelmed, and keep the death rate down. Everything is relative. We're having over 500 deaths per day. Just a couple months ago, it was only 300 in some cases per day. So that death rate has gone up just because the total number of people that have gotten infected is so high. With 1 million people getting infected per day, I mean, it's incredible. But we're not alone in this. I mean, other countries are having problems now. China, Europe, everybody is having the same kind of issues, and we've got to learn, how to deal with it. And it's going to be keeping up with the vaccinations and taking antivirals if you're eligible.
Yeah, absolutely. And our second big headline for today is that, one of the big symptoms of COVID, when especially during Delta, was loss of taste and smell, and that seemed to have decreased with Omicron. But it looks like, Dr. Murphy, are you more likely with BA.5 to be losing your sense of taste and smell?
Well, this is an important side effect because it really affects people badly. I mean, they get, this loss of taste and smell doesn't sound like is it that serious, but it makes eating really difficult because everything tastes like cardboard. So it's very disturbing side effect. Now, most of these cases do improve with time, so that's good. And there are some kind of behavioral therapies you can do to teach people how to taste again. I mean, that goes down another whole rabbit hole and pathway. But I mean, there are some ways that you can deal with that. We don't really know if this is more common or less common because we don't really know what the denominator is. We don't know how many people, is it 1 million people getting infected per day? If it's 1 million people getting infected per day, and they're not complaining of any severe side effects, or it's not getting picked up, perhaps the proportion of people having this side effect is less. So it's just really hard to say. It hasn't gone away. Let's put it that way.
Right. And then our last big headline relating again to monkeypox would be that 34 cases of monkeypox are confirmed in Minnesota, and the vaccine supply right now is very limited in the United States. So what is going on with monkeypox right now in the United States, Dr. Murphy?
Well, there's almost 6,000 cases reported. Again, it's very underreported because the testing is still not readily available. And it's spread everywhere. There's only a couple states that haven't reported any cases. And it's highly contagious in this contact setting. So it's not considered a classic sexually transmitted disease. However, any kind of intimate physical contact, which of course occurs during sex, you can spread it. So what it's become a sexually transmitted disease, not in the classic sense. But let's face it, 98% are in the MSM population, men who have sex with other men, and have multiple partners. And so that's the group that's getting it. But already there's women have been reported, children have been reported. Even a pregnant woman was reported recently, did fine with the pregnancy, and the baby's fine. But it's out there, and it can get into other populations as well. And unfortunately, the vaccine situation could stop this thing immediately. But we got caught. The United States government had a stockpile of doses of the Jynneos vaccine, which is the safe vaccine, and safer vaccine. And those doses were expired. They don't last, not like you can just keep this vaccine around for a long time. So what the US government was doing was continuing with the stockpile, but they were working with a freeze-dried type of vaccine, and that would have a much longer shelf life. So they wouldn't have to keep restocking this stockpile that's had never been used. And so they got caught right in between the switch over to the powdered form And there were only a couple thousand doses available. Now, Bavarian Nordique, the company that makes this company, they have been cranking out vaccines like crazy, and the supply has improved, but it's nowhere near what it needs to be. We need millions of doses and vaccinate everybody at high risk, which is, who knows how many people that is, over 1 million, most likely. And so we need a lot of vaccine. The other vaccine that is in the stockpile is more for smallpox, and that is associated with too many side effects. And so we can't really release that out into the population. So now in cases outside of the MSM group, they can do ring vaccination because they can track all the people that have been in contact with that person. And so that's another strategy that can be done that doesn't require as many doses of the vaccine. But in the MSM population, it's we're going to have to do mass vaccination of anybody at high risk, and quickly.
Right. Well, and now for some of our COVID questions. Dr. Murphy, we have 2 sets of Paxlovid questions. Our first set of questions is there a reason why someone in the recommended group for Paxlovid shouldn't take Paxlovid if they test positive? Like, are there any special circumstances?
Well, if you're eligible to take Paxlovid, so you're over 50 or you're over 12 with some kind of underlying disease, you should really, really try to take it. It's only 5 days of treatment. There are some important drug-drug interactions, but they typically can be managed. If you have renal disease or liver disease, you have to be very careful, and it's up to your doctor and maybe a pharmacologist to determine what a safe dose is. There's nothing we can just say here to do. But there are answers to many of these questions. And there's, I think, very few people really are on a medication or are too sick to take a 5-day course of Paxlovid. Now, the future is different drugs are being developed. And so we'll have, I think within a few months, we're going to have choices that people can take. It looks like molnupiravir, which is a different kind of drug, has different side effects and drug-drug interactions, probably fewer of them, but it doesn't work as good. And so people are they're electing not to take that because they want the one that works much better. So whether it's 30% effective or 90% effective, that's like a big difference. So anyway, I think that in most cases people can take a 5-day course of Paxlovid. But it's got to be under the direction of a doctor, and if there's any potential drug-drug interactions you're taking, that has to be dealt with right at the beginning.
Absolutely. Now for a second Paxlovid question. So if you test positive by a rapid test and you have symptoms, should you get a PCR and wait for the results before taking Paxlovid? Or can you trust the antigen test and take the Paxlovid? Do you need a PCR to be taking Paxlovid? I know it's like an odd set of questions. But yes, what do you think, Dr. Murphy?
No, you don't have to get a PCR test to confirm it. If you have a clinical picture of COVID-19 and your antigen test is positive, you have COVID. I mean, we're in this pandemic and there's 1 million cases a day. Everybody doesn't need a PCR test. Now, if you test positive and you have no symptoms, there's a couple things about that. One is that there's obviously, if you have no symptoms, there's no like major urgency that you initiate a therapy. However, if the kind of cases that I hear about is that we were at some event, the spouse or partner got infected, tested positive, and now you're sick. Now you're testing positive, even though you don't have symptoms. I would say that person with the known contact should go ahead, if they're eligible to take Paxlovid, take Paxlovid. Now, if for some reason you were just doing a test and didn't have any known contact, if there's ever a question, yeah, go get a molecular test, a PCR test or one of the other molecular tests. I mean, you don't have any symptoms, so it should be pretty easy. There's no right or wrong answer there, but you just use a little common sense, and your doctor can, is going to have to write the prescription anyway, although pharmacists can now give it out with a documented positive test. But if you have any questions, you can always ask about, should I get a molecular test, a PCR or not?
Absolutely. And for our last COVID question, is the COVID vaccine related to getting shingles? This was something we answered a long time ago, but it looks like it's now up and coming again.
Yeah. So shingles happens to a lot. First of all, you can prevent shingles by taking the Shingrix vaccine. And it's highly recommended because shingles is going to occur in about a third of people no matter what. But if you take the Shingrix vaccine, that goes way down. And shingles can be very painful. So does the vaccine trigger a shingles thing? There's been a lot of discussion about this. The answer is it's possible, but it's at kind of a very low level that is pretty similar to what we expect in the general population. So it's not an overwhelming side effect. And so it's a possibility, let's put it that way. But it just brings up this whole issue. Should you have taken the Shingrix vaccine? So if you're eligible to take the Shingrix vaccine, you should take it. It will protect you. And you won't see this problem.
Right. Well, those were all of our COVID questions for today. Thanks so much, Dr. Murphy.
Oh, thank you, Sophie.